LearnTrueHealth.com, not only are we a wonderful podcast filled with amazing, life-saving, and life-changing holistic health information, I also have a membership for you. And if you have enjoyed any of my podcasts, you are absolutely going to fall in love with your membership. Right now, it is only $25 to join, and it provides you with so many amazing videos. I actually filmed with naturopathic physicians and other wonderful healthcare practitioners in the holistic field. There are 12 sections to your membership, including a holistic health coaching section and master webinar classes and Q&As with doctors, and a behind the scenes where we pull back the curtain and you learn from your favorite leading experts what they eat, what they do when they need more energy or to beat a cold or to beat a headache, what they do naturally. And so you can learn from those who are really living the holistic way, practicing what they preach. So please go and check out learntruehealth.com/join to see all the details about your membership and all the benefits that it provides for you. That's learntruehealth.com/join. It's only $25 right now, but that price is only for the next 100 members. And I know that I just opened the membership's doors for enrollment. I had opened them briefly about a year ago, and now they're opening again. And this is a special price for a very limited amount of people. And that's because I take the time to work with those in the membership. So go ahead and go to learntruehealth.com/join and make sure you grab your spot before this special is gone. I'd hate for you to miss it and then regret missing it when you hear about all the awesome content that is there for you. Now, one of the features of your membership you're going to love is that when you really are moved by one of the videos or one of the pieces of information, you actually, there's a share it now button, and you can share it with, you can send it to a friend or family member, and they're sent a secure link where they're given access to that piece of content for 3 days. And so you can use the membership to help yourself, and you can also use the membership to help those you love. Isn't that amazing? So go ahead and check out learntruehealth.com/join and support the Learn True Health podcast. Welcome to the Learn True Health podcast. I'm your host, Ashley James. This is episode 108. Boy, do I have an interesting interview for you today. Dr. Dennis Courtney, who is just absolutely amazing at the absolute cutting edge of science and what it means to heal the body, is an expert in stem cells. And I know for some is a controversial topic, so we'll definitely be getting to that controversy and clearing it up. But Dr. Dennis assures me that he is a holistic doctor and he loves to help people heal using the power of our own body's ability to heal. So welcome to the show.
Well, thank you very much. It's so nice to be invited and to sit down with you for a change. We've communicated many times between when we first met and at least to this point. And I'm really excited, Ashley, about having an opportunity to speak with you today.
I am very excited as well because the work you're doing is fascinating. When we look at health, all of my listeners are really interested in learning more about what they can do to gain health. And we have listeners that have shared with me that they have massive health issues. Their doctor hasn't been able to help them. They're on countless drugs, or their doctor's recommended countless drugs, and they're at their wits' end. They don't know what to do. And then we also have people all the way on the other side of the spectrum who are already healthy, but just, super health nuts, always looking to learn more. And we also have a lot of healthcare professionals as well that listen. So addressing these three different listeners, we want to help everyone gain their health back holistically, naturally. And when you think about stem cells, at first we think that doesn't sound very natural, right? There's also this concern that in the past, stem cells were coming from aborted fetuses, and so that there was an ethical issue there. But reading all your literature, it sounds like you are using stem cells that are specifically coming from the patient, and so there isn't a controversial issue with using your body's own stem cells.
Well, I think you threw a number of things in there that really deserve sorting out, because I will tell you there is a lot of mystery and confusion out there in the public. I'll also tell you there is an equal amount of mystery confusion within the medical profession. So the world of confusion needs to be cleared up. This is such a tremendous, miraculous medical breakthrough that really is emerging and going to explode within the next decade. I happen to think that right now it's really at its infancy and baby stages, but I think that this rivals the discovery of penicillin in terms of the impact that the use of stem cells brings to the table to allow people to deal with health challenges in a way. I know you mentioned that I was a holistic doctor, and I certainly have been. And for someone who spent so many years learning the practice of medicine, yes, I'm a medical doctor. In fact, I'm a trained anesthesiologist. So the use of medicines, especially in the operating room, have a special consideration and are much appreciated in that line of work. I will say, however, that 20 years ago, I left that operating room. There was an allure for me that pulled me out of that level of comfort. It beckoned to me and it said, you know what? You need to practice a different style of medicine. Those drugs you use to do your job as an anesthesiologist, that's one use. And I believe that probably is going to hold true for many, many years to come. But those drugs being used by your colleagues, the medicine doctors, the people that are treating chronic disease, that's a matter altogether different that there certainly must be, and if I can tell you 20 years later, there is absolutely a way to avoid the use of all drugs. I have a prescription pad that collects dust. I'm quite proud of the fact that I never use drugs and spent so much time to be able to write a prescription that I choose not to write has afforded me quite a bit of the ability to learn about new ways to deal with health challenges. This new arena for me is one of the most pleasing entrants into the world of medicine that I've been provided in a long time. And of course, we're talking about stem cells today, but I was ripe for the picking because here again, we're not talking about something foreign. We're not talking about something that's synthetic. We're not talking about something that's a pharmaceutical invention. These cells are natural. They are normal. They are healthy. They are vibrant, and they hold great potential in store for those who want to explore this issue to deal with their particular health issues.
That was very well said. I love that you pointed out that your prescription pad has been collecting dust. So before you got into stem cells and after you left the operating room, what did you do with your patients? Were you practicing as a holistic doctor, helping people recover using natural medicine? What did your practice look like for all those years?
Well, tell you what, I guess I'm startled by the word left behind that at least was intimated, because I've just now placed stem cells as one of the many options that I give to patients. I continue to have a practice that allows anyone with any health problem to walk through the door, and we better figure out a solution to whatever their issue happens to be. Having been more recently given the use of stem cells as an option just opens up the potential to levels of success that I haven't been able to achieve before. And turns out that stem cells are quite the complement to my holistic, and I tend to use the word integrative practice. So this is just one more in a long line of modalities and treatment options that I've searched for high and low for years. I know I mentioned to you, I have my own radio show. We shed a tear a bit for over 20 years. I had the opportunity to interview experts that taught my listeners so much, but as a byproduct, they taught me. And it was so enriching for my overall education that I could never leave those behind. They are only a part of my whole repertoire, but the stem cells have really ignited a new interest in my practice. People are seeing me that are conventionally minded and because they hear that there might be a way to handle a very serious medical problem, maybe they never dealt with a non-conventional or integrative alternative doctor before, but they're coming now and they want to learn how can we deal with that same problem, and they're not being very successful in correcting it.
So let's just sort of unpack what stem cells are, because I think we keep
That's a good place to start.
But what are stem cells?
Well, every single one of us, and it really doesn't matter what our age is, but you as you sit at your desk and me as I sit at mine right now, have these miraculous cells being distributed throughout our bodies every single day, and have done so and will continue to do so. Now, a stem cell is a cell that hasn't really declared which cell type it's going to become. And that's a very intriguing possibility because, as it turns out, you can actually take stem cells either from yourself or from another human being, administer them in a concentrated fashion into an area of concern. Let's say in a very common area might be, and I think it's a well-explored area with stem cells, every joint in the body has been approached by a practitioner, a medical practitioner, with the intention of delivering stem cells to that joint. So if you could just picture a knee is a very commonly requested area for me to treat. In fact, it happens to be the number one. So if you have a knee problem, you have knee pain, if you have arthritis, if you have some degenerative condition of a lifetime, it's now intriguing to learn that you can rebuild and give yourself a brand new one of those. And how it would be done would be to administer stem cells harvested from somewhere, and we're going to be talking about all those places in a minute, I'm sure, but you deliver them into the joint capsule. And in that joint capsule, let's say there are 5 different tissues. There's bone, there's synovial membrane, there's cartilage, there's ligament, there's tendon. And wherever that stem cell lands, it declares to become a new one of whatever one of the 5 things it lands on. Those that land on bone become brand new and healthy bone, even though these cells are growing in an individual that may be of advancing age and may be have serious joint disease. These cells only know healthy cell. They don't know. The disease isn't in the DNA. This is happening outside the DNA. It is the DNA that always remembers what a healthy cell should be and can only develop progeny which are healthy, and then, after having landed in all those 5 things, begin to divide themselves. And so now that they've declared to be cartilage or bone or ligament or tendon or the like, start their divisions, and every 3 to 6 weeks, they experience a doubling time. So I use the term 10 million a lot because the kind of cells that I use happen to be sent to me at a minimum of 10 million stem cells in a 1 ml vial. And when I give them, at the time they land, they're 10 million. 3 to 6 weeks later, they now become 20 million. 3 to 6 weeks after that, they become 40 million to 80 million to 160, and this just keeps going on and on and on. And so over time, that joint, if it happens to be a joint, and we can talk about the other body parts that are regeneratively able to be restored to function once again, can in fact be accomplished with these miraculous cells. It's just a matter of where to get them. Where would be the best place to get these cells? And more than likely, I have a feeling we're going to be talking about that in a little bit. But does that answer your question about what a stem cell is?
That's fascinating. I can see that if given the option of needing a knee replacement or stem cells, the stem cells are far less invasive with a faster recovery time, I'm imagining.
Well, surgery, and here I am, I'm akin to surgeons. I'm an anesthesiologist, working hand in hand and side by side with surgeons who've been the early part of my career. There's always going to be a need for surgery. These very skilled individuals have a skill set that always can be called upon. But in any case, elective surgery, and certainly joint replacement, is almost 100% elective, should always be put as a last resort. Never should it be attempted as any first resort, because there are all sorts of complications that can develop from a very well-intended surgeon based on the health history of the patient we happen to be dealing with. So there is a pleasant ear awaiting the message that, hey, there is another way. And if you are confronting the loss of ambulation because of your, let's say, knee or hip, and your doctor has said, it's gotten so bad now, it's time for you to really think about having that joint replaced, for that individual to learn, oh no, not necessarily is that the next step. There is another step that has a high likelihood of giving me the use of my limb, my extremity, my shoulder, that can avoid surgery completely, has no real risk associated with it, but all sorts of great potential. This is an exciting message to hear. And those who have their own afflictions, and everybody sits back, and even listening to me today, any audience that I present, as they sit there and listen to what I describe, they all have their own health challenge. It changes with every single one of them. But if I have 50 people in an audience, each one of the 50 conjures up in their own mind what their particular health challenge is. And before I've left that room, I've heard 50 different requests to describe if stem cells could be used 50 different ways. And as it turns out, quite a few of those other ways are helpful too.
I'm also thinking, I mean, not for myself, but I've started thinking, well, what about healing wrinkles? Like, you see these women in their 70s who are, going for the facelift, and could you use stem cells to generate a 20-year-old face? Does it work like that?
Oh my goodness gracious, yes. There are probably, now the FDA, and we are here in the United States, and the FDA, I've got varied opinions on how I might describe the FDA, but let's take this one for the moment. Their job is to protect the public. How they do that job, we may disagree, but nonetheless, that's their charge. And we have a federal agency out there meant to do it. Over the course of many years now, the FDA has given their tacit approval of the use of stem cells for what is referred to as homologous use. Now, I'm not going to tamper my words. I want my listeners to know what the terminology is, even though they make it a little tongue-twisted. Homologous use means that you are permitted by the FDA, at least, to use stem cells for all the joints. So there's not a single joint in the human body that hasn't been approached by some doctor in an attempt to regenerate and rejuvenate a new joint. The other arena that's been well explored and certainly well tolerated and permitted by the FDA is the use of stem cells to regenerate and rejuvenate for aesthetic reasons, so that the world of the aesthetics, and these are clinics that have developed in vast numbers over the years, now have a new tool in their armamentarium to literally rejuvenate most of this request is for the face. There are other body parts that might equally qualify, but yes, you can rejuvenate and recreate a youthful face once again through the use of stem cells. I'd have to say that another homologous use, to use the term, would be in the case of, and this is now skin, burns. Matter of fact, this morning out of my own newspaper, which is called the Pittsburgh Post-Gazette, I happened to get that paper online and was looking at it. Here they've invented what they refer to as a skin gun, where literally a person in a burn unit, and I've worked in burn units, I know how tragic and how devastating third-degree burns can actually become, and ultimately the tremendous scars that are left, even with the best of medical care. They now spray stem cells with the use of a stem cell gun, in a Pittsburgh hospital, and then you see the after pictures with flawless skin. Wow. That's something that's going to be released to the public in the very near future. It's right now in the investigational stage, but it certainly made, maybe not front page, but it was in the magazine section of a newspaper that I just read today.
I've
Uses.
seen a video on that. I've seen a video. It's circulating Facebook. I'm sure we could Google that video and see it. But I've seen the video recently of a firefighter who his whole leg was horrible burns. Horrific,
That's the one.
horrific. He would have been in agony and months of rehabilitation. And it was something like within 7 days, his body was, after using the stem cell gun to spray his own stem cells onto his leg.
There you go.
He was regenerating healthy new skin without scar tissue.
And I will tell you, having worked in burn units and taken many a patient to the operating room to skin graft them, okay, that to cover that skin, even when the job has been done, the disfigurement of this grafted skin is just blatantly obvious. Now, obviously, we're so happy that the person was able to survive their injuries through the use of these, but the fact that looking at the results, I guess you saw what I saw, the results were flawless. So there's now another, and here we go, another new invention, another use of stem cells. You happen to see it. I happen to see it. These are miraculous cells, and their use is going to be nothing but exploding in the medical arena as this next decade ensues.
Now, I can absolutely get behind using stem cells for something that, like that kind of emergency medicine where, someone's been in an accident, their bones are shattered or their skin has been burned. That's something that makes absolute sense right off the bat. For conditions, for example, arthritis, we look at what's the root cause. Like if that person has a multi-mineral deficiency and that's what led, or lots of inflammation in the body, systemic inflammation and lack of nutrients, and that's what led to the degeneration of the joint. Then giving the body stem cells, the stem cells are going to rob the nutrition from other places, or not. They're not going to be provided with enough nutrition. So before injecting stem cells into a joint, do you look to help the person, get as much nutrition or figure out the root cause of what caused it in the first place? Because wouldn't it just keep repeating itself if you don't address the root cause?
Well, you really captured the essence of my 20 years of practice as an integrative medicine, because it goes without saying that the diseases of advancing age, every single one of them, is related to an interplay between three different components. One is the accumulation and the accrual of deficiencies of a lifetime come home to roost before we exit this good earth. You don't find arthritic knees in a 20-year-old. They're rare to find in the 30s and 40s. No. They begin to develop after the deficiency has been able to linger for so long that the tissue cannot no longer function. So in a way, if you wanted to make certain that you did not reproduce the same process from occurring, you would want to make certain that the new cells receive the right nutrition. The second component would be to make certain they did not accumulate toxic agents, because the second part of that triad is the accumulation of toxic substances over a lifetime. And the third component, and the one that usually gets missed, and the one that I think I'll call myself an expert in too, even though it's a little off point as far as stem cells go, is the issue of perfusion. You must have an adequate blood supply to both bring the nutrients to and the waste products away from any given set of cellular tissue in the body. And now, in a nutshell, you've given away my secret, Ashley. It is the interplay between correcting deficiencies, removing toxicities, and improving perfusion that all of my work for the full 20 years has taken that path and that formula. Stem cells, if they were delivered to a person without correcting those deficiencies, would be able to divide, and they would remain healthy for a while until they also would be lacking nutrients to such a degree that they too would degenerate. So yes, you've found the missing link there in terms of promoting health that never ends, but in terms of making certain that that actually be done before you do the stem cells, no, you do not have to wait until you've made all the corrections. The result of your incorrection has led you to where you are. So when we start and turn over, I guess we could say, a new leaf, it would behoove the patient to really get into their issues of supplementation, correct diet, removing chemicals and removing pollutants from our air and our water and our foods, and then optimizing the perfusion so as to not recreate the same set of conditions that led us to needing the stem cells to begin with.
It makes complete sense. I know a lot of people who are looking to regrow their cartilage using natural medicine, and it takes a long time. You have to, like you said, you've got to correct the body's ability to get the proper blood flow to the joint, and you've got to up your nutrition with supplements and a healthier diet. And it can take the body years to correct something. If you've spent 40 years, in deficiency and eating unhealthy, then it's not going to correct itself in a month. It's going to take years. And so you're saying don't correct everything and then wait a few years to do the stem cells when you can get the stem cells in your knee, for example, if that's what you're wanting to heal.
Yeah.
And it's also the patient would be then more invested, because if they have to pony up the money or take the time off work to go get the stem cells injected into their knee, they're more likely to avoid the bad foods, eat healthier foods, stay on their supplements, do the work they need to do. It's kind of an extra incentive because they already went through the procedure. So they imagine in their mind, I have to help these cells grow my healthy knee. So they're going to do everything to get on a healthier path.
Well, I wish that what you just said was true in all cases. I will tell you that patients come to me and they're not really out of the integrative mold. They are conventional thinking. They feel that I want to do these stem cells. They never want to have a discussion with me about the very issues you spoke of. I do have that other patient, of course, a career worth of them, but it's nice. I think the message for the listener here today is don't wait for the correction. If you have a health challenge, you can intervene and end that health challenge immediately. I would then hope that, as you've spoken of and quite intelligently, there'd be a way to conduct your life afterwards that would be extremely beneficial. But I got to tell you that it's not mandatory. That the stem cells are so powerful that they will take root. They will flourish as they had flourished for maybe 50 or 60 years before they couldn't function anymore. And the degenerative joint disease really originated. They had 30 or 40 years of wonderful use of their extremities. And then one day or 1 year, 1 month, things started to go downhill. I'll let them decide. I'll always be there to counsel them if they request my counsel. But you don't have to think that you have to do that in order to do stem cells.
Now, I understand that there's so many applications that are possible, but you had mentioned that the FDA has only approved a handful of them. As of right now, what diseases or conditions can you treat using stem cells?
Well, you really get into the issue of delivery. So in my own hands, every single joint, a lot of skin procedures have been what has been requested of me, and certainly with the FDA's approval for homologous use, fall right within the realm of what is recognized. But I got to tell you, I have patients that come to me with all sorts of other problems, specific problems. And so trying to develop a way so that we can deliver the package directly to that area has been a challenge of mine that I'm making great progress on. I can't really reveal because it hasn't been finalized yet. But let's just say this. Another common way that I do feel comfortable in administering these cells would be an off-label use of them, which would be to administer them intravenously. I have treated a number of patients with intravenously administered stem cells. Now, in the case of IV-administered stem cells, if you put anything into a vein, if you start an IV, every bit of venous blood goes to one place first, and that place happens to be the heart. After the heart, it passes from its right atrium to its right ventricle, and then to the first organ where some good can be done, and that happens to be the lung. So I've got good news for people with chronic obstructive pulmonary disease, chronic disease and breathing conditions. COPD is a common set of initials used to describe a whole host of very long-lasting and not to be reversed by any conventional means set of disorders that we're able to deliver literally entire package to the lungs, because that happens to be the first stop. What becomes difficult is trying to calculate how many of those cells actually make it out of the lung, are able to come back to the heart, and then can be pumped out to the rest of the body. This is what I'm not in control of right now. And so I have requests. I'll give you one set of requests that really are quite a particular specialty item with me. And I think you've been to one of my websites, PittsburghEyeProtocol.com. I have very serious eye diseases that I treat alternatively, and I have a very good track record with reversing those diseases. But I have patients who want a major leap with stem cells that can't be assured that they get that leap by administering them IV. So in the next few months, what I intend to do is be able to put a program together that allows them to be delivered via catheter directly to the eye and the eye alone. So I'm not really in the completion stage of that program. I would suggest anybody that has an interest in any organ other than joints, skin, or lung, follow with me. Keep following along with me, because there'll be a way that I think in a very short period of time that we will be able to deliver that package in a way that I refer to as direct delivery. So it's all in the delivery. Joints are an easy one. Skin is an easy one. The lung, as it turns out, is an easy one. Other organs other than the lung can be successfully rejuvenated if we can deliver the package to that particular organ alone. And so I would say to your listeners, stay tuned to this station for future announcements that will be able to reveal when and where that option may be available, because really it's going to take our FDA many years to work through the rigorous and arduous investigatory process before they're going to be able to bless the use of these cells for non-homologous use. And the people that I see don't have 10 and 15 years. Their issue is now, and they'll be interested to learn how they might be able to deal with it in the now. And once again, stay tuned to this station.
So I just want to let listeners know if this is, I know there's going to be some that have absolute piqued interest. The links to everything that Dr. Dennis does is going to be in the show notes of today's podcast. Now you have a website, stemcellsolutionsofamerica.com, and the phone number is 813-702-4415. That information is going to be in the show notes, and you also have your website, PittsburghEyeProtocol.com. The Stem Cell Solutions of America, tell us a bit about you have a 7-point checklist that you offer to listeners, and that's also a way they get on an email list, and then you'd notify them when you have there's all sorts of.
Yeah, there's all sorts of. I mean, there's all sorts of. 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 There's all There's all sorts of opportunity at that site. I would say that we've got a webinar on the site that I've done many, many times, and I put it up on the site. It is a primer of everything that you need to know about stem cells that by its intention is intended to make you the better consumer. As I hope we're going to get into very shortly, because we've moved to talk about the 7-point checklist, I'm going to be going down through 7 points that will allow a person to lose their vulnerability to being, I don't want to use the word scammed, but I'm going to tell you that I'm saying that out there in the stem cell world and the stem cell industry, this industry is not grown quick enough to understand what's even available to them. And so what I felt was important was to be able to take a person and in a short period of time allow them to lose their vulnerability so that if anyone should ever approach them, or if they ever want to explore stem cells, they would have a checklist of questions to ask that would allow them at the end of the checklist to know if they were getting the right kind of stem cells or not. And so because I saw that it's so important, I decided to come up with this 7-point checklist to make you a better consumer. And that checklist is going to be available to anyone after our show today who might like to get a copy of it. We can send them a PDF version of it. If they'll go to info@stemcellsolutionsofamerica.com, they too can get a copy of this that I think would, if they're ever considering stem cells, there are questions that you need to ask in order to remove your vulnerability. And I guess we may get into those 7 or numbers of these 7 in the next few moments, and I'll be looking forward to doing so.
Okay, excellent. Well, yes, actually, I am concerned. When I was pregnant, I kept getting stuff in the mail about, because, the second you're pregnant, you get marketed to, I shop at one maternity store, and all of a sudden I'm getting all this mail about being pregnant. And they kept asking me to apply to store the cord blood, the blood of the cord. The umbilical cord, and all the reasons why it was positive. And I kind of got a scammy feeling. It was a bunch of different agencies kept trying to get me to do it, and it seemed expensive. And then I saw an article that when a child loses its tooth, that underneath the tooth they can swab and they can collect stem cells. And I thought, that's interesting, but also, how do I know? How do I know if I'm being scammed? So this is great. Why don't we get into this? What are some warning signs that we should look
Let's do this. I think the first step is to say this. Right now, at last count, and this count would be as recent as this past September, so it's pretty fresh. At the current count, there are over 600 stem cell clinics in the United States. Now, on the one hand, that sounds like a large number, but on the other hand, if you sort of spread that out over 50 states, that's really not that large of a number at all. This stem cell issue is going to have a meteoric rise in the next decade. There's going to be 6,000 stem cell clinics as the public demands more and more with respect to how these cells may help them. But here's the point I think I really want to emphasize with your listeners. As it stands right now, these 600 clinics, 99.9% of all those clinics use what are referred to as autologous stem cells. Now, by the word autologous, this really means that the stem cells are coming from a person and then are given back to that same person. So in a sense, the individual is both the donor and the recipient of the cells. I started my conversation by telling you every single one of us has stem cells in our bodies all the time, every time. The point to make with this is, however, that there are 3 body fluids that are used to be the donor source for the autologous cells. The first of these is blood, and the procedure is referred to as platelet-rich plasma, sometimes called PRP. I got to tell you that when a blood specimen is taken in a centrifuge, the cells go to the bottom of the test tube, the clear blood comes to the top, and a line of demarcation falls in between the two levels called the buffy coat. And those are where the white cells are. And just above that is where platelet-rich plasma exists that has a whole bunch of growth factors and cytokines and other healthy materials, but have absolutely and positively no stem cells. So my first precaution to people who are moving into the marketplace is that if it turns out that the donation to do the stem cells is going to be your blood, and I notice these clinics continue to, in a mythical way, describe them as stem cells, there are absolutely and positively no stem cells in PRP. So I wanted to make sure our listeners understand that. I think that's really important. The second body fluid, and by far the most used as the source to harvest stem cells from one individual, is the fat. So you go to the stem cell clinic, they perform a minor liposuction technique. They harvest approximately 60 cc's of cells by virtually sucking it out through a syringe, and then take those cells, those fat cells, and manipulate them by washing them, centrifuging them, collagenasing them, rewashing them. It's literally a 3-hour process that ends up with a smudge on the bottom of the last test tube. And in pointing to that smudge, the doctor will say, now in that smudge right there, those are the stem cells. And those are the cells that we're going to inject in your knee or your hip or your shoulder or wherever it's going to be. The third source of donating stem cell from one person and then back to the same is bone marrow. I have to admit that this is rarely done as an office procedure. PRP and fat are almost exclusively done as office procedures, but the bone marrow is usually reserved for an in-hospital procedure where the specimens are taken to the lab and then dealt with in a highly sophisticated way. But the point I want to make is this, and I think it's the salient point that when finding out what kind of stem cells are being proposed for these listeners of yours, is to ask the age of the patient who's going to be both the donors and recipient. And the hard fact is that after the age of 20, which I look at 20 as awful young, as far as I'm concerned, after 20, the stem cell population drops off so considerably that by the time you reach your 50s, 60s, and 70s, there are virtually no stem cells at all. And so I believe it is inappropriate for doctors to claim they're using stem cells in this way, having especially fat, and by all measures, PRP, which has no stem cells, and claiming wonderful potential exists from receiving stem cells, admittedly from themselves, from the same person, but there are very few stem cells in it. I will not quarrel with the results that any doctor claims that he makes. If he says that he's had a number of patients that have responded well to their stem cell experience, I'm not here to challenge that. But I am here to say, if they did that well with such a minor number of stem cells, how well would they do if they had the optimum number of cells? And so autologous stem cells for the young, yes. If you're a young athlete, if you are, and I very rarely see young athletes, they don't come to me. They go to sports medicine doctors. They see orthopedic surgeons. So I have to tell you, I've never seen a 20, 25-year-old patient requesting stem cells. The people that I see are from age 50 and upwards, sometimes well into their 80s, who are coming to me And I know doggone well their stem cell population is 0 to none. And I don't think that the consideration of autologous stem cells is an honest presentation. But yet 99% of all the stem cell clinics in the country are using autologous cells. So question number 1 of my 7-point checklist can now easily be addressed by a listener by asking the doctor, are these autologous stem cells or are these, and the other category is called, it's a big word, but it is the only word, and that is heterologous. I guess it's okay to say, are these autologous or non-autologous and still get away with it. But if you're seeing a member of the 99%, I already know what the answer is, and my advice is there's a better way. There are better stem cell harvesting capabilities, and in this case, because of the patient's age, autologous stem cells wouldn't be my recommendation, and I hope that the listener benefits from the emphasis that I place on the very first question.
So these heterologous cells?
Heterologous
cells.
Heterologous.
So there's about 6 clinics, if that, in all the U.S. that would do it. Obviously, yours would be one of them. Where do they come from?
Now, the heterologous cells, let's be first say where they never, ever, positively, 100% never come from. And that would be from any embryonic donation. In other words, the real issue, and I get asked this question as the first question out of any audience, hey, are these things coming from aborted fetuses? Are they coming from the donation that occurs from abortion clinics? And the answer to that question is absolutely, positively not. George Bush in 2001 actually signed a bill, a law that outlawed completely the use of embryonic cell. Obama changed that slightly and allowed embryonic cells to be used for research purposes anyway, and they're not making them into the marketplace. Nonetheless, they are being used for purposes that I might not necessarily like either, but that is in fact the status of embryonic cell donations today. We're talking about cells that are obtained from freshly delivered, fully formed, and completely healthy babies that were delivered by scheduled C-section with the health of the mother properly screened by the companies who process these cells. So at the delivery date, once the baby is handed off to the pediatricians, the surgeon then delivers the cord and the placenta and hands them off to the awaiting surgical team that then takes those organs back to home base, back to the lab to process the stem cells that are contained within them. So these cells are brand spanking new. They are juvenile. They are vibrant. They are human. And as such, the first question I get asked because of it is, well, don't they and won't they cause some sort of a rejection reaction? And I think that's a legitimate question. But if we just cancel that question out by saying, if an adult organ is donated to another adult, and whether that be a heart transplant or lung transplant or kidney transplant, from the moment that organ is put into the new donor, the immune system of that new donor identifies that organ as foreign, and a rejection reaction begins, some of which actually ends up claiming the life of the donor because the rejected organ actually gets disintegrated and doesn't function anymore. In the case of umbilical cord and amnion cells, so these are the two sources for heterologous processing. In either case, both of these cells possess something referred to as immune privilege, and as such, do not, cannot, will not provoke a rejection reaction of any type. By the way, there happens to be two other body tissues that are equally the same, and they are equally immune privileged. One group of cells are those cells which form the cornea, and you've heard of corneal transplants done. They don't have the tissue type corneas. You just require a motorcycle driver to have a mishap with a Mack truck, and you have a donor. So the other area are the gonads, the testicles, and the ovaries are also immune privileged. So these three tissues of the human body do not and will not provoke an immune response. And so that is absolutely necessary to understand, so as to know that you don't have to worry about your body rejecting them. They will not reject these cells. And they are, because they're coming from a brand new baby, these cells, in terms of their number, they're off the charts. What better example of a rapidly growing being than a baby? And you have had your own, Ashley, and you've watched their growth go through exponential changes because of the vibrancy of their stem cells. And so harvesting them from the umbilical cord would be the initial source to begin with anyway, but they can be harvested, they can be processed, and they can be cryoed. They're frozen, and then they are able to be thawed in my office when they are sent to me. Now, you mentioned something that I believe that you're going to find more and more in the public domain. The thing that you went through with your delivery, where you were offered the opportunity to have the cord cells of your own baby harvested and stored, is becoming universal now. There's virtually no obstetrical department in the country that doesn't at least offer that. I know it's expensive. I understand that. But at least the offering is made. And those cells, once they're harvested, are cryoed and frozen for up to 21 years. And should that individual need and would like to have their own cord stem cells, that just makes the donation really complete, because in that case, they aren't heterologous at all. They are autologous. So there you go.
Wow, that's fascinating. And pardon my ignorance, stem cells don't have the person's DNA? Do they just copy? So I'm just wondering, like, if you take that baby's stem cells after, of course, like washing it and everything, like you had said, and then give it to the donor, does the stem cell then become the same as the donor's DNA?
That's a great question. I've never been asked that question. Excellent. These stem cells are a blank slate, yes. And as I mentioned right at the start of our conversation, they land and they become the cell type of the tissue that they land on. And that cell type is recognized as the DNA of the recipient. So it is the patient's DNA. The DNA is not diseased. It may be a knee that's diseased. It may be a hip that's diseased. The disease process is occurring in every other part of that cell except one place. And that place is the nucleus of that cell, where the DNA resides. And therefore, when that cell divides, it can only divide into another healthy cell, but all the organelles of that cell are diseased. They're not working well. And that's why other progeny turn into disease cells too. In this case, this is a fresh slate. The stem cell recognizes the healthy DNA of the recipient and then only duplicates that healthy DNA, and only that healthy DNA, as the divisions occur and that the progeny develop, so that over time, exponential masses of cells can accumulate. Great question. I'd never had it asked of me before, but I hope that answer clarifies.
Oh, it does. And it makes me think, I've been wondering in the back of my mind how stem cells could be used to help treat cancer. Would a stem cell, because it's a blank slate, if you sprayed it, gave it to the body and it got onto a tumor, would it then just become more of that tumor cell, or would it be able to become a cell?
I'll tell you what, another one of fantastic questions. I have been asked this. In fact, I don't think I get through a presentation without this one being asked. And so the way I discuss the cancer issue is I don't look at stem cells as a way to cure any cancer. So if someone was thinking about stem cells as a solution to their malignancy, that is an improper consideration. But what I will tell you is this. What if you had a cancer, what if anybody has a cancer brewing inside of them and they don't know about it? I mean, these cancers take so long to actually fully develop and become fulminant. So there's a number of years that go by. And would the stem cell regenerate cancer cells? And the answer to that question is an emphatic no, it will not. It cannot regenerate the DNA of an unhealthy nature. The DNA in a cancer cell is deranged. And as such, due to its derangement, the stem cell recognizes its derangement and will not allow it to be reproduced. So if you had a cancer and you didn't know about it and you received stem cells, you can't expect that the stem cells are going to be provoking or adding to the load of the tumor in terms of its size and its vibrancy and the like. That marches to the beat of its own drummer. Unfortunately, those drummers get pretty high in pace and cadence. These are DNA that are completely out of control. The metabolic rate of these cells do not compute to a stem cell and are not duplicatable.
I'm starting to see why you're so passionate about stem cells.
Oh, have I stumbled upon something that I enjoy? Yes. Do I enjoy bringing a message to listeners that allows them to envision there is a way? There is, yes. You think that you got a health challenge. There are many ways to work through trying to improve upon it, but there really is a potential solution out there if we can handle the delivery issue. So I'll refer to my stay tuned to this station comment and move on. Shall we go through our list?
Absolutely.
All right. So I said it was a 7-point checklist. I think I've handled point number 1 as well as I would like to. Here's point number 2, that you need as a consumer to be able to ask whoever it is that is offering you the possibility of stem cells. So here it comes. If they are heterologous cells, are they amnion derived or umbilical cord derived, right? Because these are the two donors of these heterologous cells. The reason I mention this question is just based on the sheer quantity alone, the amnion contains very few stem cells when compared to the vast numbers of stem cells that can be located in the umbilical cord. So to be honest with you, the first time I ever used stem cells in my own practice, I was actually administering amnion cells. I was quite pleased with the results of the patients who received it. But the number of cells is always the important consideration. And the moment that I saw that the number was just so much more exponentially large of the total stem cells that I could administer, I rapidly converted over to the use of umbilical cord cells. This in by no way means to downplay how important amnion cells can be. It just points out that amnion, if given the opportunity to have amnion or umbilical cord, this is a no-brainer. Go for the umbilical cord simply because of the sheer volume of cells that were harvestable and are now able to be given to you. That's point number 2. Any questions, Eric, or can we move on?
That makes complete sense. Thank you.
All right. Checkpoint number 3. If the cells are from the umbilical cord, so we've sort of been led down a path, and we're in the right arena now. We're talking about umbilical cord. I know what's available in the marketplace. And this next question is going to floor the practitioner that you ask this question to. But how about this one? If the stem cells are from the umbilical cord, are they processed to remove all cord blood? Now, I got to tell you, you probably wouldn't think about asking that question if it wasn't implanted in your mind to do so. But what I find is the inability for many companies who actually harvest the umbilical cord cells to never completely remove the red blood cells. And the red blood cell carry potential for causing reaction. So you see, immune privilege is conferred onto a stem cell from the umbilical cord. It is not confirmed onto a red blood cell of the umbilical cord. And so to completely remove any rejection or reactions of any type, you had better make certain that all red blood cells have been removed. So you can see that's a very important question. It's going to floor the practitioner of whom this question has been asked. And if you cannot be given an absolute direct answer in the negative as to they are not, yes, or I guess maybe the affirmative, yes, all red blood cells have been removed. Or if you are answered, well, geez, I don't know, then this is the time to get up and walk out, because there's a safety issue here that can be avoided, and I want my consumers that I educate to know about it. Fair enough?
Yes, that makes complete sense. Do you have is there specific labs that or clinics that do this to 100%? Or like, I know that people can come to you to have the procedure done, but you don't yourself do it. So do you have a lab do it for you?
Wow, Ash, I don't know who's feeding you these questions, but I'm going to tell you there's another question that's great to ask. No. The public needs to know that the FDA, there's that FDA again, the FDA controls very directly the companies who are in the arena to offer umbilical cord or amnion cells. There are rigorous testings that these companies subject themselves to in order to please the FDA enough that they are offering a product that is completely safe. Once again, that charge that federal government gives to the FDA is to make certain that the safety of the public is maintained. And so based on the company, if they have a processing capability to remove the cells, that's all done at the company. That's all done by the individuals who are processing and then cryoing and then ultimately selling into the marketplace their particular product. And I will tell you that very few companies make that extra step of removing the red blood cell. Consequently, they better have all sorts of warning labels on the product. The FDA is going to compel them to have them. And so everybody who's using a product with the red blood cells in it already knows, because the FDA has made certain that they are included in the package inserts, that these cells do contain red blood cells and as a consequence have the potential for reactions. So no, I do not get involved with, nor should I ever get involved with, the harvesting, the preservation, and the marketing of these cells. They're done by companies that have this as their primary function only. And in stark contrast, the FDA is really becoming unhappy with the clinics who use autologous stem cells, where they're harvesting and then manipulating cells that they then give to that patient. And literally, if there's 600 clinics, there's 600 different processes that are going on every day, and they are not in control of them. And the FDA is soon to change the equation, I feel, because they're not real happy about clinics managing their own safety issues, if you know what I mean. So companies do this that are well invested and are under FDA control, and I think the public needs to know that. And by hearing they're either getting an amnion or a cord product, at least they know that much. The FDA is involved. You cannot just have these cells in the marketplace without having the FDA allow you to do so. Okay?
Makes complete sense. Thank you for that clarification. Step 4.
Step 4, here we go. The next question I want the consumer to be able to ask is to the practitioner, what is the actual number of stem cells contained in that product? And let me just say this. I'm a little upset with my colleagues who run these stem cell clinics, and they're taking fat and manipulating it and then looking at the bottom of the last test tube and finding a smudge there. And they point to that smudge and they say, hey, there are the stem cells right there. And that is complete erroneous and not correct, because there are many cells there. There are actually very few stem cells, depending on the age of the person who was the donor, but there are cellular debris, there's hematopoietic cells, there are neural crest cells, there are cells upon cells, but there are very few, if any, stem cells. And so if you look at that smudge, you're thinking, well, there they are. Well, in fact, no, they're not. When it comes to the FDA certified products, however, it's possible to know the actual number of cells. And I'm talking about not an estimated number. The product that I received from the company that processes and then sells those cells to me, in every single package tells me the exact number of cells. I don't know. I doubt if there's somebody with a magnifying glass and tweezers doing that. They have some electronic way of pulling that off. But I can guarantee a patient that when I administer cells, here's the package insert for this product, and this one vial right here that I'm holding in my hand has a minimum of, and there it says 10 million or 11 million cells in that vial, and you can take that to the bank. So do not ever settle for estimates, is my caution to the public. If they don't know the actual number, then there is no actual number. And let's get to the quick to think that there may be a better product out there that is actually able to state it. I think it was important enough to include as my 4th point. It's self-explanatory. I would say that as a general rule, you would want to find a product that have at least 10 million cells in 1 ml. And the more, the merrier. If the product has 15 million cells, that's a better product. If that's 18 million cells, that's a better product. And just by using what intuitively makes sense, the more the merrier, I think will carry them in good stead. Fair enough?
Makes complete sense.
All right. We're coming down to the home stretch. Are we okay with this? Number 5. Have the stem cells been preserved in any synthetic preservative? This is another no-no, because I find, and then this won't happen in the autologous clinics. There's no preservation at all. I mean, they harvest the cells, and they immediately are giving them back, usually within 3 to 4 hours. But if you're a manufacturer of processed amnion or umbilical cord cells, these cells are going to be stored for, well, actually, in the case of the obstetrical application, 21 years. And I don't know why, and maybe a company can answer me why, they actually store, for the most part, these cells in a synthetic solution, the most common of which is DMSO.
Oh my gosh.
Now that's a nice solvent, and the percentage seems to be the same. I read the literature, and it tells me that it's in a 10% DMSO solution, which I can't answer you why they feel they need to do it. But here's what I can tell you. During the freeze, during the cryo, this synthetic material doesn't have any harm that it exposes the cells to. But I will tell you this, and you can take it to the bank. Upon thaw, which is what happens when the cells make it to my hand. When I'm just about ready to give them, I have to hand thaw them. They're frozen in a 1 milliliter vial, and over about 5 minutes, with just gentle warming of my own body temperature, they thaw. Within 15 minutes of thaw, if those cells have been stored in DMSO, those cells are dead. And they can't even have a cell division occur. So I really think they're defeating the purpose if you store this stuff. In fact, in the industry, they store this stuff in DMSO because many of the more intellectually inclined members of the medical community call these cells zombie cells. Now, where do you think they get the word zombie from? It's because the cells under a microscope are dead 15 minutes after they're thawed. That means they're dead inside of you 15 minutes after they're thawed. That means, what could you expect to be able to correct if you're using dead cells? I think it's an appropriate question to ask. And if the cells are stored in DMSO, I say get up and walk out.
Wow.
How about that?
Amazing. Yeah, that's so amazing that so many people are, wasting good money and good time on and all their hopes and dreams, for healing, and then they're given a product that doesn't work.
Well, and you think they would never ask about what the solution was that they were stored in. This is not a question that rolls off the lips of a non-medical person. This doesn't even roll off the lips of a medical person. I mean, that's like highly specialized stuff, but it's a point that I felt so compelled to reveal to. I want people that I meet to be able to leave me, and with this 7-point checklist, they are impenetrable in terms of being exposed to a product that wouldn't give them the best result. And so we got 2 more points to go. Shall we move on?
Yes, thank you.
All right, point number 6. And here's a big word. And when I send you a copy, if you're a listener and you want a copy, I can appreciate why you may have to see it written in front of you. But it is very appropriate to ask, what is the total mesenchymal, I know it's a big word, mesenchymal cell content of those stem cells? Now, I mention this word mesenchymal because this is one particular cell line, because there are many kinds of stem cells. There's one particular cell line of the stem cell community that's the workhorse of all stem cells, and they're referred to as mesenchymal cells. So the higher the content of whatever the product happens to be of mesenchymal cells, the greater the likelihood that your particular issue is going to be dealt with in a definitive way. Now, in the company that I've become comfortable with, my product insert is able to quantify the percentage of stem cells in the product that I hold in my hand. And so to be able to know this is something I believe that a patient deserves to ask. They should ask their doctor, hey, what's the mesenchymal cell count of your product? And if he says he doesn't know, you can get up and you can walk out. I say that there should be, at a minimum, 30% of the total stem cell count should be from this mesenchymal cell line, stem cell line. And if you're assured that your product can quantify that, you're dealing with the product that would be able to offer you the ultimate potential for improvement. And I think it's a fair question, and that's why I've included it. All right?
Sounds good.
Now, final question. And I think it's an important question, especially after having discussed this issue about synthetic preservatives. But the final question is, what is the total number of live cells after thawing? You see, the companies who process these cells have to test their cells with each and every batch before they ship them. And every single product insert that I receive with the particular product that I may use verifies the cell count viability in that particular product. And if it doesn't reach a level of 97% or higher, this product does not get shipped. So I am assured that when using this particular product, in order for it to get to my hand, number one, it had all cord blood removed. Number two, it was actually able to tell me what the numbers were of the total cell. Number three, that there was no synthetic preservative in there. Number four, there was at least 30% mesenchymal cell count. And five, at least 97% viability, meaning I'm giving the cells, if 10 million are going in, 97% of them are going in alive, well, and healthy. I like that number. I want the public to know that number. I think it just completes your education as a consumer to be able to arm yourself with the proper questions to the doctors that are in your area and dangle stem cells in front of you, but yet aren't clear enough, and you weren't even clear enough yourself to even know what could be asked. Well, I think that task has now been accomplished. I really enjoyed you giving me the opportunity, and of course I'll answer any other questions you have, but going through that checklist allows me to complete my entire reason for wanting to come with you today, Ashley. I think we've covered this topic very well. What other questions? I'm almost afraid. Well, no, I'm not afraid. I'm intrigued. What other questions?
I have a lot, but we'll definitely wrap it up soon. So I do know someone who was in a horrific car accident, and the doctor said absolutely won't live, and if he does live, he'll be a vegetable. And his mother is in the holistic field, and pulled out all the stops, and now he is walking. But he had to. He's in his early 20s. He had to relearn who he was, how to walk. His brain literally had to reset back to zero. And what I heard, one of the many things, and she has them on all kinds of supplements and therapy and everything, but she says that they're doing stem cell injections into his spinal cord, and that they're seeing that memories come back after they do that every time they do a treatment, memories come back, and but they are getting it from his fat. So I'm excited to share this information with her because I could just imagine if some memories come back every time they inject some, stem cells from his adipose tissue, if they then do it the way you recommend, oh my gosh. But would you use stem cells injected into the spinal cord to help with recovering from brain injuries, or is that out of the scope of practice, or is that well within your scope of practice?
Well, let's just say this. You remember me, the anesthesiologist? Mm-hmm. The spinal canal and the epidural space, that's my playground. That's my space. And so delivering stem cells either epidurally or intrathecally are well within my scope. And certainly, as we talk about this issue, and it amplified in terms of direct delivery, that I have, there's stuff on the YouTube, by the way, if you ever go to it. And by the way, if you contact our company, we'll send you the link of a case you just can't forget. A lady with Parkinson's disease. Now, that's a very tragic degenerative disease, the only reason I remember her is she had received fat stem cells, which did nothing. And now we can understand why. But then she went and she received intrathecal. By the way, that's what you call the injection that's given into the spinal canal. That's intrathecal. She received the umbilical cord cells, the very product that I use because the company knows about her. And she went from a wheelchair to walking down the hall within 24 hours. This was a miraculous occurrence, but after all, this all does come down to the delivery, does it not? And so this issue of direct delivery is what's been oh, it's been working at me. It's been haunting me. It's been gnawing at me, and I'm so anxious to break out of the confines of what might be allowable today. Okay. And I have to tell you that if they're doing intrathecal administration of stem cells, they must be doing it in a university level. And there are universities who have investigational programs that are able to do, as a common practice, that which has not made it out into the hinterlands yet. Well, I need to make that available to people who may not qualify for a university program. You know, the description of the individual that you describe was a devastating set of mishaps, which led to, well, I'm pretty sure everybody thought he was going to die. He's come back slowly. These are the kinds of people that get the opportunity to do stem cells at the university level because, quite honestly, the directors of the program say, well, what the heck? We can't hurt him. Look at this poor guy. I mean, we might really be able to help him. I need to have people that haven't reached that point also feel that there's a way that they can have their issue addressed and not have to get to that level, that they can intervene much earlier than waiting to when they do qualify for the university research use of these. And I swear that's my mission. I swear that in 2017, I will accomplish that mission. And I'll say once again and finally, stay tuned to this station.
Excellent. I'm just thinking about, you mentioned Parkinson's. I'm thinking about MS and Lou Gehrig's
ALS.
disease.
How about the
Yeah,
big three?
ALS, exactly, right?
ALS.
And also
Absolutely.
dementia. So there's so many people now who are suffering from dementia, and the numbers just going up, especially as baby boomers reach their golden years. Is this
Exactly.
have you seen stem cells injected intrathecally that would help bring back the mind?
How about actually taking this one step better? I don't believe when it comes to, let's say, the after effects of Alzheimer's, or how about this? How about a stroke? Okay. And I actually don't think that the intrathecal delivery is the best delivery. To me, how about this one? If we could conceptualize this. If we could advance a catheter either through the elbow or from the groin. By the way, this is done every day all over this country. There are cardiologists that do catheterizations. I'm sure you're very familiar with that, right?
Mm-hmm.
That's something that most people have heard. Cardiac catheterizations, where they actually pass a catheter up into a coronary artery and then they nail in stents and they blow up balloons. Have you heard of those before?
Mm-hmm. Yes.
Okay. So that cardiologist, by the way, is also trained to permeate the carotid artery. And if you can advance that catheter instead of into the coronaries, if you can advance that catheter into the carotids, you have a complete access to the blood supply of the entire hemisphere of that individual's brain. I believe that you have to deliver the package from the inside and not the outside. Intrathecal is in the spinal fluid, and the delivery is a package to your doorstep. Delivery of a package through an artery that goes to the very capillary meshwork and the cellular structure of whatever organ you're talking about is delivering the package to your kitchen table. This is night and day, in my opinion. So that I put together various ways to accomplish my objective of providing cells via direct delivery. It's going to be incumbent upon me to look for the better way. I think in Parkinson's and in MS, that better way may very well be intrathecal. When it comes to mental deterioration or stroke, I believe the better way may absolutely not be that at all. It might be to deliver it by catheter, in which case I'll use my patient. The that I'm very familiar with, and that's the patient that's rapidly losing their sight. And I sit with these patients. I do a group of these patients every month in a special program. I hope, by the way, if you're a listener and you are afflicted with serious retinal diseases and you've been told that nothing can be done, that is a lie. That absolutely is not the case. And please go to our website at pittsburgheyeprotocol.com to find out more. But I'm meeting with patients who are going blind as we are talking to one another, and they tell me, look, I would rather die than go blind. And when they tell me that, it just punches me in the gut, because I think I know what they're saying. The loss of that sense is so important to them that the fear of losing it is just devastating in the anticipation of the loss. So I'm going to be able to report, I hope, in 2017, direct delivery to the eye. And I'm looking forward to being able to come back sometime and talk about how that all goes, because I'm telling you what, I'm looking forward to be able to reverse these various serious eye diseases, which all comes down to where's the best way to deliver the package. And to me, if it comes to structures of the brain, that's intra-arterially. If it's Parkinson's, it sure looks like it's intravenous, not intravenously, but intrathecally. And the list will go on and on and on, and there'll probably need to be a host of patients that receive them both before we'll actually know. But this is not being done right now in the U.S. You cannot get, I don't know where this program is, where this man's getting intrathecal injections of umbilical cord cells, but that's a pretty difficult to find clinic available to probably very few in the public. I'm anxious to learn more about it. I'd like to know where they are and what organization they're working with, because I'm fully.
I'll get that information for you. Actually, it's they're rendering it from his fat. But what I was saying is that
he gets it from fat.
He gets it from fat.
Okay, that's right.
But if he were to get the highest quality cells that you're mentioning, I'm sure he'd have it sounds like he'd have a far better result. So I'm going to find out and I'll get you that information, and I'm definitely going to get your information and give it to them, because I think this is, that's so fascinating. Thinking about the eyes, and that you have this 3-step program to help people heal eye issues like cataracts and glaucoma, which is, like horrific. So you have to do a surgery or you have to get injections in your eyeballs. That's sort of the allopathic traditional method of treating it, whereas you have a holistic approach to healing the eyes. And I love this idea that you are pioneering the stem cell industry and how we can use them to directly deliver them to the eyes. I'm wondering if obviously this is a hypothesis, if we could help heal the blind in certain circumstances where they've lost their eyesight due to conditions of some form of degeneration or maybe a chemical exposure or something, and would stem cells be able to actually create healthy new cells and bring back eyesight? That would be amazing. And then think about other senses, like those who have gone deaf, or just think about I just keep thinking about all these possibilities of what we could accomplish. My passion and my love is for holistic medicine, preventive medicine, helping the person achieve health through healthy lifestyle, healthy daily choices. I would hate to wait until you get sick and then go for the knee surgery, right? Whereas we could prevent it through years of being healthy. We can prevent disease down the road. But you know what? You meet the patient where they are. And so if the patient...
Well, you know what, Ashley, let me just jump in there and tell you, you've really struck another nerve with me when it comes to the eyes. And I'd like to be able for those listeners right now who either themselves or have a loved one that is suffering from these very serious retinal diseases. Let me just tick through the macular degeneration, glaucoma, diabetic retinopathy, retinitis pigmentosa, macular hole, Stargardt's, and the list goes on. These are the cumulative group of diseases that are referred to as retinal diseases. Now, the cold hard reality to all the retinal diseases, and I want to underline the word all, is that in the conventional medical world, there is absolutely, positively nothing that can be done to either A, stop the further progression of that disease, or B, absolutely not back it up and improve it. Now, I say that because there's some pretty intelligent ophthalmologists out there. I mean, I don't mean to diminish their intelligence in any way, but they are a prisoner of their own training. They were taught a skill set that are never going to offer an answer to those retinal diseases because they either have drugs, surgery, or procedures. You cannot win over these diseases through trying to treat a disease. You have to reestablish health. It's obvious to you that you know that. The message I want to deliver is these programs that we're talking about, and they're on the website that we mentioned, are 3-day experiences in 3 days. I know this is going to sound outlandish. I hope I have some level of trust that I've been able to generate with the listeners listening to me over this last, what now becomes over an hour and a half. I hope I have some credibility with them. You can reverse, not just stop the disease. You can reverse and have a substantial improvement in your vision with any of those retinal diseases, and it begins in 3 days. That's a great message to bring to somebody who has had no help and will get no hope from their conventionally trained doctor. It's because it can't happen with conventional training. It does come down to nutrients, toxicity, and perfusion, the very 3 elements that we talked about at the very beginning of our podcast today. Turns out to answer the key in just about every disease that I treat. The fact that there's a pretty advanced way of doing it so rapidly is the point I wanted to make for your listeners. And then also to say, when we've completed our 3-day program, we haven't ended anything. We've just begun something that will continue to get better with time using those modalities in home. So the final issue that you brought to my attention by asking about a blind person harkens me back to about 1 year ago when doing a program here in Florida at my Zephyrhills office. I had a 16-year-old boy who was black blind in his right eye and perfectly normally sighted in his left. You see, this 16-year-old was a fencer, the fencer with the foil, fencing. It's a kind of athletic sport, and you put that little cage around your head and you're supposed to like a sword, right? You know what I'm saying when I use the word fencing? Mm-hmm. So here he was. He accidentally got stuck in his right eye with the foil that was accidentally performed by his coach. This kid went black blind in that eye and has been black blind in that eye ever since, and perfectly normally sighted in his left. So let's use my good, and I love this boy, 16. What a core of just sheer, never getting down, never depressed. He's just quite a specimen. In 3 days, he went from being black blind to seeing shadows. You understand what a leap that was for him? To know that there was a reversal. He was told there's nothing that reversed this. And do you know who is going to be, and he doesn't know it yet? You know who's going to be my first patient that's going to get direct delivery to their eye? And I intend to be able to report back to you the answer of your hypothetical question, which might even have been a rhetorical one.
Yes, I'm so excited.
I truly believe that those cells of his retina can be returned to normal function. And it couldn't happen to a nicer boy. And in terms of being able to do this, you talk about not having someone that we can worry about harming. The fellow is black blind. Yes, he can see some shadows, and he was elated but it's not enough. He deserves to be able to be sighted again. And I don't know how much sight I'm going to regain. I don't know whether this is going to take one stem cell administration or more. I just know he deserves his chance. And hopefully that chance is but a few months away. I hope to be able to come back and tell you all about it.
I am so thrilled. It's been wonderful having you on the show. I have one last question, and that is for those who have been so inspired by hearing you, and they just would love to go and meet you and have the stem cell therapy. Is it something that's covered by insurance? How does it work monetarily?
Well, I can tell you, and probably not just for today, but for very many years into the future, there is no insurance coverage for what could be considered, and probably appropriately so, experimental medicine. This is considered experimental even with the tacit approval the FDA has for homologous use. It's going to take many years for this to work its way into healthcare plans. And so, unfortunately now, no, it is not insurance covered. The use of these stem cells isn't the cheapest thing either. I fully understand that. To harvest these cells and be able to store them, you can remember some of the numbers that may have been passed your way when you were considering, or at least had presented to you, banking, that's the word, banking umbilical cord blood of your child. Do you remember what some of those numbers were, by the way? I'm figuring at least $10,000. Is that what they were?
It was. I think it was slightly less than that, but it was a considerable amount of money, and it ranged depending on the offer. So that's again why the red flag went up.
Oh yeah.
Why one would be 2,000 and one would be 10,000, and yeah.
Yeah, that's the low end. So no, these are pricey, but many patients realize that that's their last stab at it. Now, we have lending institutions that work closely with us. We are not the bank, but we're able to try to hand them off to lenders that might be able to help them be able to muster up enough funds to do them. As far as consulting with me personally, my goodness, by going to the website, you have an opportunity to get a free consult with our office on your very matters. So I would direct anybody to either A, go to our website at stemcellsolutionsofamerica.com. You may send in a question at info@stemcellsolutionsofamerica.com. Also, you can request a copy of that 7-point stem cell checklist if you tried to write it down, but then, oh my God, he's talking too fast. I could never do it. No, we'll be happy to send you a copy. No matter where you may be hearing me from today, and it may be far from where I happen to be sitting, which is in Tampa, Florida, there are people who did stem cells in your backyard. They may very well hold the answer with the right product, and they're only a stone's throw away from where you are. I wish that is possible for you. I hope it is possible for you. But if we can talk, maybe we can either identify somebody near you or work out a way to meet you individually if you really choose to do so. So you can call us too. Some people don't have the use of computer, especially I'm dealing with people with eye problems. The number here is 813-702-4415. That's 813-702-4415. All sorts of ways to do it. By the way, at Stem Cell Solutions, the entire webinar that I think we recreated, Ashley, I think we did a very good job. I covered all the points I thought I'd like to. I just did it in a different way today, and I really like how you led me into this discussion, and I like where we ended up. A very formal presentation of the same is also available at the website that you can do at your will at any time you'd like. Head there if you want to hear it again or play it for somebody else. And also, there's your link that you're going to have soon, Ashley, that they can go listen to your podcast by going somewhere, even though I think today you don't know where that somewhere is, correct?
This podcast is going to be on learntruehealth.com, and all the links to everything that Dr. Dennis Courtney does is going to be in the show notes of today's podcast. Thank you so much, Dr. Courtney. This has been absolutely amazing. I look forward to having you come back on the show and share with us the miraculous things that are happening in the stem cell world. You are definitely at the cutting edge, a pioneer in this industry, and it was my privilege to have you on the show today.
Privilege was all mine, Ashley. I look forward to talking to you again, and someday our paths will cross and we'll actually meet face to face.
Enjoy what you heard today on your episode of the Learn True Health podcast. Did something move you, inspire you? Did you get great information that's going to change your life? Awesome. That's exactly what I'm here to do, is to help you gain your health back. Please turn around and share this. If this is something that's helped you in any way, share this with those you love. Love the Learn True Health podcast and want to support us? Awesome. You can go to takeyoursupplements.com and you can support us that way. You'll get access to amazing supplements that are just really great quality for a great price. And there'll be someone on the other end of the line to help you pick out your supplements that are right for you. That's takeyoursupplements.com. Or join our membership, learntruehealth.com/join. That's another great way to support our podcast, support our movement, and you'll be supporting yourself. Gain more information, wonderful videos, wonderful trainings, and you'll also be able to share those with those you love as well. So go to learntruehealth.com/join. Want something fun for free? Go to learntruehealth.com, and right there on the front page, you'll see where you can get our free cookbook. I spent a lot of time making it, and it was so much fun. It's really delicious, healthy recipes. And you can also get our 7-day doctor course. Right there, it's 7 days of naturopathic videos sent right to your inbox, and you can learn from top naturopaths on how to gain health naturally. So that's takeyoursupplements.com for wonderful supplements. learntruehealth.com/join to join our awesome membership, which is only open for a limited time. You can get our free healthy cookbook, and you can also get for free 7 days of wonderful naturopathic videos sent to you. Just go to learntruehealth.com and you'll see it right there on the front page. Thank you so much for being a listener, and thank you for sharing and helping others. Let's spread this information and turn this ripple into a tidal wave.